Welcome back to the podcast. I'm your host, Ben Imes, here talking about the depths of healthcare. Got a great guest joining us today, Dr. Rosenblatt. Seth, why don't you introduce yourself and kind of where you come from?
Sure. So my name is Dr. Seth Rosenblatt. I am currently in Washington, D.C. I am a psychiatrist by training, and I operate an intensive outpatient substance use treatment center called Vive Treatment Centers.
Cool. And how would you say you kind of found your way into this niche in terms of substance use? Because with psychiatry, that can be very wide ranging, obviously. A lot of things to treat, a lot of things to look into. How did you find your way into this specific category?
I thought I wanted to do actually primary care when I entered medical school. And so I was really involved in doing family medicine and family medicine interest group. As I kind of went through med school, I kind of realized that I wanted to work more directly with patients. And I just started to do a lot of work. I knew a lot of folks from personal connections in the DC area recovery community, friends and acquaintances and family. I'm actually in the recovery community myself as well.
Mhm.
And so I started to work mostly when I was done with residency and during residency and psychiatry residency with folks with substance use disorders. So I was doing a lot of prescribing of Suboxone, which is a drug that folks will take to help with opioid use disorder. I had worked a lot with folks doing alcohol withdrawal, and it just seemed to be one of the branches of medicine that I find fairly satisfying because you can see, long-term sustaining results in individuals, whether it's changes in, relationships with family, friends, ability to employment, improvement in health status. So, I found
Yeah.
that I was making a direct impact in the communities that I was working with and, wanted to continue to do that.
How did you kind of find your way into, continuing this patient care? Because you got to walk with these patients for probably years for a lot of your census, I'm assuming. I mean, that's a lot of pouring out and empathy.
Absolutely. Yeah, I think being with them on that journey, a lot of them are going to, as part of the disease of substance use disorder, are going to potentially have returns to use. Some may not, but kind of just knowing that you're there for the patient, that you're part of that journey, that they have someone that they're able to share their successes and other difficulties in life with.
What are some cool things that you've seen just in different treatments, that are coming out, or different advancements that you're seeing, and specifically in your field that are kind of you're excited about or suspicious about? What are some things you've seen?
I think they're starting. I'm not to do some alternative kind of therapies for substance use. I know they've been working to try to do studies with like transcranial magnetic stimulation and whether or not it
Mm.
helps with substance use disorders. They've been trying to work on some other novel medications for things like stimulant use disorder, for which there's not really a medication that you can necessarily take to help with that.
Right.
Kind of in this field, a lot of it is working with kind of oldie but goodie type treatments that people may not be using, but that are highly effective. So, kind of encouraging folks to understand what those treatment options that do currently exist are. Only a very small percentage of people who do have substance use disorder actually receive adequate treatment, which includes medication, just because it's not readily available. People don't know it's an option,
Right.
have not engaged with people that have presented those options to them. So kind of, working in the system that exists. I know some folks have been doing like injectable naltrexone implants, which are not, available in the US, but that have been available abroad that seem to be highly effective.
Mm. Mm. Okay. Yeah, I hadn't even heard of that. I just thought naltrexone was naltrexone pill form, and that's it. That's pretty cool. What Now, how do you, I mean, coming out of residency, you normally, correct me if I'm wrong in this, you normally come out and just look for the health system to jump into, or the mentor to kind of follow. How did you find your path to where you are now? What other jobs did you have to kind of bump through, if you did? Tell us about a little bit about the journey to get here.
Yeah, there were several. So I graduated residency in 2018 from psychiatry residency, and I did get a fair amount of experience mostly because I sought it out during residency, working with folks with substance use disorders. We actually do a rotation for 2 months at a treatment facility, and so met them there and got experience doing that. But once I graduated, I was actually a National Health Service Corps scholar. So what that is, it's a federal program where once you complete your training, you have to serve for 4 years in a federally qualified health center in an underserved discipline. So that includes primary care and psychiatry in underserved areas at federally qualified health centers. So my first job out of residency, I worked for Whitman Walker Health. They're a federally qualified health center in DC that works with LGBTQ populations primarily, but
Yeah.
they have a significant substance use program, both providing outpatient services for opioid use disorder, and then they also have a outpatient treatment as well. But I was doing mostly psychiatry and medication management. That kind of bled into COVID, so that was my first job out of residency. Everything started to go virtual. Point, I was having a lot of difficulty with that. Just sitting from home, kind of doing psychiatry appointments, not being
Yeah.
able to go into the office. I did start to look for other positions at that point. Started as a medical director with another federally qualified health center to finish out my service in Baltimore.
Mm,
Total healthcare, very underserved section of West
mm,
Baltimore doing medication management. And they also, again, had a outpatient a substance use treatment program that I was very involved with, both seeing the folks for medication management and also doing opioid withdrawal and
yeah.
opioid use disorder management. From there, I went to do inpatient work actually. So psychiatrists are trained to do both inpatient and outpatient work. So I moved to hospital system, worked there. I've also done on the side kind of transcranial magnetic stimulation and ketamine for treatment resistant depression. But after all of those things, I decided that A, there were not enough resources for individuals with substance use disorders, and B, that I most likely did not want to work within a health system or for anyone else, and kind of wanted to branch out on my own, as scary as that was.
Yeah. Talk about that. I mean, that transition point of, okay, I don't want to work for the man anymore. I like myself as my own boss, but how do I start this thing? Who do I talk to? What were the kind of first steps?
It's a good question. So I learned a lot from this process. Initially, I had spoken with some consultants. There are a lot of consultants out there who, if you look up kind of substance use consulting, will say, okay, we will, work with you to start a whole program from start to finish. We'll do your
Mm,
business plan. We'll do your, finding a rental space. We'll hire your staff. We'll do all of these things. And they sounded great in theory. And
mm.
so that was who I initially talked to and went with.
How did the theory not match the practicality?
So I moved on in the process. I had learned that there were a lot of players in the space who simply, obviously, if it was as easy as hiring someone else to kind of start and run all business facets for you, then most people would be doing that. But had learned that, is not necessarily the case. And they had said that they would do certain things like, set up an EMR, set up billers, do XYZ. And, a lot of it was not the case. And I had to learn a lot of these things by myself, which I think was a good lesson because I'm at the point now where I fully understand how, systems function. I kind of make a lot of these decisions. I'm not having other people, do it for me. But that was the initial way that I looked into branching out on my own.
The school of hard knocks.
Mhm,
Yeah, got your education, got your degree there.
mhm.
And obviously there's like mistakes and kind of learning lessons. People say like, I either learned from this or this was a big mistake and I never learned, or they continue to make it. Sounds like that wasn't quite a mistake, but there was an opportunity there from the business consultants that you hired
I
or
think it
worked.
was definitely a learning process. Like I had hired as part of that someone as a secondary consultant after this primary consultant to assist with DC licensing and joint commission
Mhm.
accreditation because we needed both to be a functioning substance use facility in DC. And at the time, I felt very helpless. Like I can't do any of this. I need other people to do all these things for me. I'm just coming out of these jobs. I don't know how to do any of these things. But, now I'm doing them all. I'm not, relying on other people. I just renewed our DC license when they requested all these documents again.
Right.
You know,
Yeah, so I've had better experiences since the initial.
correct.
Yeah, and so, when you start your own practice, I mean, there's so many different kind of variables that come in. Obviously, you talked about the health record that you have to implement, scheduling appointments. Are you doing that? Or who did you hire to do that? Are they capable of doing it? And then all the staffing to back up. And that doesn't even talk about the brick and mortar side of things versus doing telehealth as well. Do you find in your practice that it was easier to kind of navigate the in-person virtual aspect as well as like the hiring process and all the other components of starting your own business?
So I always knew so I do have a private psychiatric practice as well that's kind of separate from the substance use treatment disorder. And there I definitely see folks virtually because a lot of it occurred during COVID. We're still trying to figure out the navigation of the virtual versus in person for the intensive outpatient substance use program. We are mostly doing in person at this point, just because for these individuals that need more intensive care and treatment, it seemed to be the best fit to do things in person. But yes, definitely I had to figure out the whole HR, I'm now the HR manager in addition to everything else. I'm reviewing resumes, I'm interviewing people, I'm hiring a staff person, I'm doing payroll and in QuickBooks for them. I'm, managing their vacation time and their
Wow.
benefits and just all of these, things I had never expected or learned how to do.
Yeah. Yeah. But you kind of like just had to put on the hats and get through with it, right? Is that what you found out?
Correct. Yeah, because there is in the end run, obviously the goal is to treat as many patients, with high quality care as possible, so the most people will recover from substance use disorders. But at least initially starting out, especially a small business and a practice, there's no one that is going to do those things for you. And so you basically have to learn how to do everything and to be able to understand how everything works, which again, I didn't know when I first started out, but I have a much better grasp of that, now 2-ish years in the process.
Right. And kind of what other hurdles do you still see that are still affecting your practice and then we can flip that after that answer of, what you're excited about, what's coming down the pipeline.
I think the biggest hurdles I have experienced that continue to be hurdles are regulatory. So we had,
Yeah.
you know, biggest issue that I had experienced in trying to start a substance use intensive outpatient facility was licensing. So we had to get licensed by the DC Department of Behavioral Health, and they will not grant you a license to provide substance use services until you are fully accredited by the Joint Commission as an outpatient center. And the only way to do that is to see patients and have a system and have all your policies and procedures. And so we couldn't even apply for a DC license until we had that. Then it took them, they did not at the time have a computerized system to apply for the license, which they now do. But there were 25 documents that you would send them, including certificates of occupancy, fire. I had to get my floor that I'm leasing out, examined by the fire inspector and
Yeah.
give them 25 documents. And then they'd come back and say, no, this, and this is missing, and you need this.
Oh my gosh.
Almost a year probably to get the initial license. All the meanwhile, we're not really seeing, significant patients and, paying for facility and staff and all of that kind of bundled on top of that. The insurers, unfortunately, part of the thing I wanted to do was to, allow people to use their insurance. Most treatment centers, folks may have to pay out of pocket, which is not obtainable. So we're in network with all the major insurers, but that was the biggest challenge because that took months and months and months in kind of a black hole of negotiating with insurers who also often said, this document's missing and we've never received this. And, we switched staff and here's another 3 months. So that's been the biggest challenge. And now actually it's working well and they're paying us. I think where we are is kind of implementing a system to where, we're able to send the claims in timely, get the co-payments, things like this.
Yeah. But you almost needed a whole compliance team 'Cause
Mhm.
it's so tedious. You're like, "How am I supposed to see patients and get all these things put together and organize everything?"
Absolutely.
What, I mean, that's such a hassle. It's already a headache even just hearing about it.
I think the exciting part, you said what is exciting. We are implementing in terms of recovery. It's given us the ability to we're expanding in patient reach. So our groups obviously started out really small. Now we're up to a patient group in the evening. And so we're looking to, expand that probably, hopefully, in another few months. We'll have a second evening group running, but we're also doing alternative recovery things. So we had a songwriter come in for 6 weeks and kind of did a music songwriting
That's cool.
class with folks, kind of helping them channel some of their experiences into songs that they created.
Wow.
And then we're doing yoga and Reiki as well. We have someone in the community who's doing 12-step yoga. So we have a lot of, more innovative things for folks
Yeah.
that we're to implement.
And are these things that you're looking into, like, you have seen implemented in other practices or substance use practices, or something people coming to you for?
The music, I know some places will do that. This was specifically, she worked on music and mental health and had actually written a book that she has available. And so someone had introduced me to her. Yoga and kind of other mindfulness stuff I've heard of in other practices. Some people have, come to me and also, suggested things like acupuncture, craniosacral treatments as well, which I'm looking into. It's kind of a varieties of chosen to implement, and then some other people are kind of presenting some other.
Yeah. And do you consider yourself, as a business owner and a provider, do you consider yourself very open to all techniques and ideas and experiences, or are you kind of like, you don't want to kind of want to stay in a certain range?
No, absolutely. I think, it's a lot for people to sit in groups for 3 hours a day for 3 times a week.
Yeah.
So I think anything we can do to try to make the therapeutic experience more uh, you know, interactive and impactful. So I'm definitely
Mhm.
open to what other folks you know, have to offer. I think, again, it's kind of how do you implement those into, the practice and billing for XYZ and having a provider
Wow.
present and,
Yeah.
incorporating all of it into their treatment.
And have you made other providers, like, are other providers that are in your community, are they getting interested to help out, or have you hired other people to kind of like assist you in these ways?
So we have, like I said, the we have the community yoga person coming in to do the yoga. We have the music person. We're still hiring and kind of finalizing the clinical team in terms of like a clinical director. We've had people come in and give lectures and talk. So yeah, I think we're slowly kind of getting our name out there in the community.
Very cool. And so it sounds like it's all pretty organic at this point in terms of how you're getting your name out there, and, word of mouth kind of, people kind of talking about it. Hey, like, I'm having good experience in this space. I think it would work for you, kind of thing.
It is, yeah. I think there's some digital component to it, which I'm working with some folks on to revamp kind of the initial website that we had. Again, that was also done with one of these
Yeah.
consultants who kind of just threw a lot of words on a page and said, here, let's do this with search engine optimization. And at the time, I said, sure, that sounds great, and really didn't put a lot of effort into, reviewing and making sure the website actually reflected what we offer. So we're trying to revamp the digital marketing and website piece. But then a lot of it at this point is, yeah, organic. We've been meeting with inpatient facilities in the region, other outpatient providers, therapists, things like that to try to, make them aware of the services that we're offering.
Oh, super cool. I'm hoping that gains some traction for you guys, because it's things like this that really change lives. I mean, I see it in the ER every now and then where, I mean, it depends on the person, right? Who walks in asking for a Suboxone refill because they got sick and missed their appointment or something along those lines. Sometimes they're there and they're like, it's a rock and a hard place. They're like, I don't want to be in the emergency room, but I know that this medication helps me. And they come in and their COWS score, the opiate withdrawal scoring is, 3 to 5, kind of mild, moderate-ish, and you're like, uh, it's hard to put yourself in their shoes is what I kinda try to kinda think about it. I'm like, I'm becoming a more and more big proponent of just saying, "Let me help you. Please let me go out of my way," just because it's so prevalent in our society, but if somebody's really inspired to pursue their health, you know, why not assist them in that journey?
Such a stigma as well, unfortunately, with substance use that a lot of people are, ashamed to come forward or don't know who to turn to or whatnot as well. That if someone, I've kind of seen if someone makes that initial effort or, has any motivation, in kind of the motivational spectrum to change their behavior, you kind of have to work with what, they're coming in and presenting with.
Yeah, and if they're motivated, like, I wanna meet them there at that
Right.
motivation level, right?
Absolutely.
And that's I think we, you know, piece by piece, provider by provider, we can continue to change that stigma, but it just takes, stuff like you're doing, to kind of really change the narrative as a whole.
And even they've found that there's a lot of studies, I think I had read, that providers, even in the ER, that sort of thing, just, find that patient population, too challenging to work with. So they just are further stigmatized and not treated, in a respectful manner, or the provider just kind of, you know, chooses not to, work with them or provide the quality of care. And I think part of it is providers may not be trained, on how to work specifically with folks with substance use disorders. Like you were saying, you have to meet the patient where they're at. But, a lot of times, most of these patients have had a lot of significant trauma, whether it's, sexual
Mm,
rape or violent or other things that, may need some different approaches than kind of your standard patients.
right. Yeah. I'm hopeful that it continues to trend in the up and right as we always talk about. But just continuing to help more people. And I hope that your clinic continues to expand too, into the point, where you get a little bit overwhelmed and then have to hopefully not ask for another consultant, but ask for more providers to come help and assist. But any closing thoughts for our listeners, like that you'd like to share, just to kind of where they can find Vive or where they can connect with your services or where they can look things up?
Sure. Yeah. I think in terms of the provider audience, if you have a passion for something, then I would advise you to go ahead and do it. It's not easy, and you're going to have to be wearing multiple hats at least initially. But I would advise to go ahead and do it. I think something that I learned from all these consultants is, you know to have a sound business plan. And so that would include, financial projections as well as, other things that a business plan would contain. And again, we're not given any training in that. That's not something someone comes to you and says, you should have a business plan and you should have a pro forma with XYZ. But I think it, makes it much easier to, achieve this dream and to, obtain funding and that sort of thing. But yeah, service wise, we're in DC. We're by the DuPont Circle Metro. We have our website online, so vivetreatmentcenters.com. We have Instagram, Facebook. People can always reach out to our main phone number that's there. Even if, we're not the service that they're looking for, a lot of times we do get folks or calls from family members, from folks in the community kind of looking for other resources that we may not be able to offer but can refer them to. So we just like having that dialogue and discussion with people. But also if you are, listening and kind of facing challenges, dealing with substance misuse, it can get better. There are resources out there to assist you.
There's resources and there's hope. I
Mhm.
think I think you're pointing that out and making that clear. Yeah. Well, I'll make sure to include the links in our post and make sure that people can kind of get well connected if they need to. And thanks for offering yourself as a potential ally in that
Yeah,
journey.
absolutely.
Well, Seth, thanks for the time. I think that's all we got for today. We'll enjoy to catch up in the future, and I hope things continue to progress for you.
Awesome. All right. Well, thanks for having me. I appreciate it.
Thanks, Seth.
Thanks.